So we're here with our next interview. We have our longtime friend, Vesi. He's from Finland, and he's been with us at all our Biohacker Summits. Vesi, today we have some fun questions from our live stream. How should we alternate between sitting and standing to keep our circulation system in function?
Okay, we should combine between walking, standing, and sitting. So 10 to 30% of the standing in the bits of 10 to 20 minutes for regular people, and then at least once or twice an hour to find any excuse to go walking, rather on the stairs if possible. So I even prefer going to make phone calls or Skype calls or whatever, so that you are walking between two stairs, and then sitting the rest of the time.
Okay. You are the creator of these chairs that we're sitting on here today. Can you tell us, why is posture so important? Like, what's the most important thing that we need to know?
Actually, chairs are just like a side product. So my main message and gospel is good sitting health, that even if we are living in a very sitting hostile environment, if we are aware and do the best practices and habits, we can stay healthy. But we need to pay attention to the clothing, our sitting habits, exercise habits, and also keep our circulation organs, like all the vessels, which are huge amounts, in good order.
You told me something a couple years ago that was really interesting about, we were watching a girl walk by with tight jeans on, and you said that girl is going to have a lot of cellulite. Can you tell us why wearing tight clothing isn't good for our overall health?
Now that we have 700 kilometers of microvessels in each 100 gram of our self-tissue, and they don't have any protection against any pressure. So even tights or jeans or any clothes that put any pressure on the skin is hurting our circulation, and in the long term is also hurting the vessels where the lymph and blood vessels are going. And if the slow flow in those vessels is slowing down, it means that we start building up cellulite, varicose veins, and other these bad things.
Okay, very interesting. How do we increase oxygen in between our discs L4 and L5? This is a question from our live stream audience.
Yeah, that's, who knows how many hundreds of millions of people in the world are suffering from low back syndrome now, and in 90% of the cases it's concentrated on L4, L5 disc. And there we are missing the artery on L5, which is on the placed on every other vertebra in the spine. And also when we are slouching and the backs are rounded, then the muscles and soft tissues get tight. And so even the small amount of blood which is coming through the vertebral artery on L4 is not able to nourish the L4, L5 disc with oxygen and nutrients. So that we need to have good posture and a lot of micro activity in the low back to be able to keep it healthy.
Okay. Why are these chairs good for us? Like, what does this kind of sitting position do?
Well, first, they are very anatomically optimum designed so that the thighs and the buttocks get very little pressure, and if we keep the gap open, the pelvic floor and the genitals and the tailbone don't get any. We also need to have a very loose, slacky clothes over there, preferably in women, slacky and loose skirts and dresses, and with men, truly loose trousers. And together with good ventilation and lack of pressure from the clothes and almost no pressure from the chair, we can put our pelvic floor and the pubic bone into the gap, and so we get the same posture to the pelvic as in standing. And this posture mechanism is vital to our upper body health.
Can you demo for us? A lot of people work on their laptops, I guess. So if we don't have a stool like this, what would be the optimal way to sit?
Yeah, as soon as the thighs go up, we will start slouching automatically.
Okay.
And then when we start slouching, because the pelvic cannot be in the right position when we have 90-degree angle, it's impossible. And so we start slouching, and then everything goes wrong from the neck down. But when the thighs go down, we automatically correct the position to resemble standing.
Okay. So is it better to be standing as much as possible, or
no?
No.
The joints in our knees and our hips don't stand long-term standing. The cartilage over there needs pressure off, which comes from moving and walking around. And we have multiple professions all around the world for hundreds of years where people have been standing with lots of problems in their lower extremity joints.
Okay.
So that's not good.
Yeah, you already answered the question about how to increase, have better posture when we only have a regular chair.
When we have a regular chair, well, the way to survive on regular chair is that you go to sit as close to the edge as possible, that only your sit bones barely are supported by the chair.
Okay.
And there you spread out your thighs as far as they go, and you can also take the feet a little bit further so that the knee angle is more than 90 degrees, rather 135 degrees. And in that position, your pelvic allows you to push it more forward, which will allow you better posture. But if you go back in the chair and try to use the backrest in normal working, it's hopeless.
Okay, so sit at the edge of your chair.
Spread your legs. Push forward your feet a little bit, and tilt forward your pelvic.
Okay, very interesting. Thank you very much for being with us here today, and see you at the next live stream.
My pleasure.
Thank you.